So for today's video, we're gonna talk about Perilight. So the first thing we need to do is check for the doctor's order on the patient whether the doctor has instructed to perform Perilight on the patient or not. And after we checking that the doctor did order to perform Perilight on the patient, we will now identify the patient properly. So you can do this by asking for the patient's name and birth date to verify them. May buntag ma'am. Ako din si Martin Zodra Cruz, isa ka student nurse sa Cebu Naman University. Niya, nakadali karon ma'am from mo perform ng Perilight. Ang sa niya ito ma'am? Okay. Ma'am niya Valentina. Niya to birthday ma'am? Okay, September 15, 2000. So once we have verified and identified the patient properly, we will now explain the procedure to the patient and ask for consent. So currently ma'am is mag-perform ko Perilight nimo. Hindi siya mag-require siya na magbutang ko ka ng lang matabangan sa iyong private area para matabangan ka na mawala ang sakit kung hindi kumati. Nga para sa dali ang ayos sa iyong sa mga sama, di nakuha nimo kung nanganak ka. Okay ra ba yung ma'am? Okay ma'am. After explaining the procedure to the patient and asking for consent, we will now wash our hands and prepare the necessary materials such as a blanket, a flashlight to substitute the Perilight, and a flushing tool for the Perilight after the procedure, which will use a cotton pad and a alcohol. So we will now wash our hands and do proper hygiene. So after washing our hands and preparing the necessary materials, we will now place the patient in a dorsal reclining position and cover them with top sheet in order to ensure privacy throughout the procedure. So ma'am, i-raise na ko mohang tuhod ma'am ha, ito ko na kong tuhod ma'am ha. Di mo man ka ng pinaka-ideal na position para yung procedure ma'am. So okay rin ma'am? Yun, kailangan ka ma'am ha. So, tama sa tika blanket over ma'am ha, para maka-privacy. So now, we're gonna place the Perilight 18 to 24 inches away from the vagina of the patient, as this is the ideal distance to ensure that there is proper heat, but not too much heat that can cause a burn. So ma'am, mabutan ako sa Perilight ma'am ha. Ako raise ka dito ma'am ha. So I'll place it 18 to 24 inches. So now, I'll remind the patient not to touch the Perilight. So ma'am, gawin siya ma'am, bakit? Di na tayo po ma'am ha. Kaya makapasok man siya ma'am. Ayun na siya sa ma'am. Okay. So ma'am, visit ko niyo ma'am every 5 minutes ma'am to check kung wala na ba kayo reactions sa Perilight o to check if kung napaka na feel ni discomfort or pain. Hindi na ako ma'am ha, kaya visit naman po every 5 minutes. So after placing the Perilight, we must ensure that we have visited the patient every 5 minutes within the time span of 20 minutes to ensure the safety of the patient and as well as to ask if they feel any discomfort or pain, which is not ideal for the procedure. Then after 20 minutes, we will now remove the Perilight. It is ideal that we will remove the Perilight within 20 minutes, as going over that can cause a burn on the patient. So ma'am, ako na Perilight mahal. After removing the Perilight, we will now assist the patient in a comfortable position. So ma'am, ako na shade by konti mo na. Comfortable na ka na ma'am? Okay ma'am. So after performing the Perilight in the patient, we will now clean the Perilight using the antiseptic solution. For this case, we will use a cotton pad and a alcohol. So after cleaning the Perilight, we will now perform aftercare materials such as returning the alcohol, the cotton, and the Perilight to their proper storage. Lastly, we will now document and record the findings in the nursing chart such as any discomfort or pain felt by the patient or any sigh of relief. And lastly, we also record our FDAR for the patient. So this ends our video for the Perilight